Well, I like to know my doctor has empathy.
I have a lot of empathy for people who get off the airplane going, I'm sick and my face hurts. I mean, it was one of those times I never will forget it. I was on the airplane and we were descending and I'd been taking exams. I was really sick and my face hurt for 3 days afterwards.
Oh.
It was terrible. So I like the idea of flying more than I actually like getting on the airplane to go, but you do what you got to do.
Right.
I think that flying has gotten a lot better in terms of, trying to keep people safe and trying to keep people healthy on an airplane. But the things you can do to protect yourself is make sure your nose is open on the airplane. And when you are descending, make sure you have some water or something like that to swallow to help make sure your station tube stays open.
Welcome to the Swain Sinus Show, a physician and patient discussion on how to better manage and treat mild to serious sinus issues and conditions. From diagnosis, treatment, home remedies, and surgery, Stacy and Dr. Swain will talk about improving your quality of life, breathing easier, and feeling better. Let's take control over our sinuses and allergies so they don't control us.
Hello, everyone. This is Stacy Wellborn, your host with Swain Sinus Show, sitting here with Dr. Ron Swain. How are you today?
I'm great, Stacy. How are you?
I'm doing well. So good to see you.
Thank you. It's nice to be here.
I have a really random question for you today.
All right. Well, let's hear it.
Why, when I go on an airplane, do my ears pop?
Great question. So when you go up, when you're changing altitude, when you go up in an airplane, the pressure changes. When that pressure changes, your middle ear, you start feeling that pressure. And so the way your body handles that is you yawn or you swallow and your eustachian tube opens and the pressure equilibrates in your middle ear. The middle ear is kind of a closed space. And so when you change altitude, whether you're going up in the air or whether you're scuba diving and going underwater, their pressure changes, and that can affect your middle ear. And so the eustachian tube is designed to open and allow the pressure to equilibrate across, in your middle ear, more or less, more than anything else.
So I guess it happens in elevators too.
In elevators, it can happen when you're driving in the mountains. If you're going up, depending on how high you're going up, your ears will pop. It's a perfectly normal response to a change in your altitude.
So example, if you're in mountains, you might be going up and down. It must not be that much of a change required to change that pressure.
It depends. I mean, sometimes people are more sensitive to it than others.
Oh, really?
But anytime you're going up and of any significance, you're going to feel it in your middle ear.
Why are some people more sensitive?
Well, the patency of the eustachian tube. Some people have some holes in the eardrums. Like if you have tubes in your ears and you go up in an airplane, your ears don't pop at all.
Oh.
Now it's a problem if you're scuba diving and you're underwater and you've got holes in your eardrums because water can flow in your middle ear. But a lot of times, parents of children who have ear infections, they ask, "Hey, is it okay for me to fly?" And how many times have you got on an airplane when you've been sick and your nose has been congested? I mean, I still remember one time when I was flying home from college. It had been after exams and I was sick and I got on that airplane and as soon as we got up in the air, my ear started hurting and then my cheeks started hurting and then my head started hurting. It was just because I was so congested and my eustachian tube couldn't tolerate, didn't open well. And so usually it's not so much a problem as when you're going up as when you're descending.
Really?
Oh, yeah.
Why is that?
I don't know. That's a good question. I think it has to do probably... Sometimes when you're going on an airplane, you go up really quick, but when you're descending, you're going down for a longer period of time. But people can have pain on ascending too. It just seems like the more of the stories that I hear, it's a kind of a gradual descent. You're very rarely going down super quickly. At least, hopefully not going down super quickly.
And then you're not worried about that if your ear's popping, if that's the case.
Right, exactly. But if you have a bad sinus problem or a bad ear problem, that can be painful. But when the ear pops, that's a good thing.
Okay. So there have been times when I'm riding in planes or elevators, whatever that change might be, where I feel like I can't get it to pop.
Yeah.
And so I'll open my jaw really widely, or sometimes you chew gum. What does chewing gum have to do with anything?
So the eustachian tube has muscles around it, specifically the tensor tympani muscle, and those muscles are attached to your palate. And so by chewing, by opening and closing your mouth, and even yawning sometimes, when you open long enough, those muscles pull on the eustachian tube, the muscular portion of the eustachian tube, and it opens. Now, there's a bony portion of the eustachian tube as well, which is usually not affected by those muscles, but you're trying to get the bony portion, the muscular portion of the eustachian tube to open. And sometimes people will land and they're like, I can't get my ear to clear. I can't get my ear to clear. And then 20 minutes later, it will clear. They actually did a study not too long ago that I remember reading one time that tried to measure how long it would take for you to have a negative pressure in your ear, for you to be feeling that kind of feeling that you have before you actually can develop an effusion. It's not uncommon for people to come in to see me after they've been on an airplane and they'll say, hey, my ear won't pop. And you look in the ear and there's serous fluid behind the eardrum. I'm not talking about like pus, like when you have a bad ear infection and you've been sick for days and your ear starts hurting. I'm talking about kind of some thin, viscous, liquidy type fluid that can form in the middle ear just because your eustachian tube's not working properly and you're going up in altitude.
Okay.
Fortunately, most of the time that will resolve with medication. The first question I ask those people is, have you had a lot of ear problems? If you came in to see me and you've been on an airplane and you've got that effusion in your ear and you've not had a lot of ear infections as a child and specifically as an adult, most of the time we put you on medication and we can get your middle ear to kind of open up and clear. If you have had a lot of problems and your eustachian tube is not working well and you get that kind of problem, it's a longer process. Sometimes we do make a little incision in the eardrum and suck all that fluid out. Sometimes we put a tube in the ear, but we don't start off with that. Most of the time we start off with some observation, some medication.
So if I'm on the plane or in the elevator, it's not popping, so I'm yawning, I'm stretching, I'm chewing gum. Are there any other things that you recommend?
Well, you can try and use the Valsalva technique. That's when you pinch your nose and you blow.
Oh, yeah. Okay.
And
so that's not dangerous? For some reason, I think that's not a good idea.
Well, you asked what else you could do. You can do it.
Okay.
But sometimes you don't want it to hurt.
Right.
But what you're doing with that is you're trying to force air up your eustachian tube. In other words, it's not opening. Sometimes you can give it a little bit of a nudge.
Okay.
And get it to open. A lot of times people will say they won't be able to do it because they'll start to do it and they'll start having pain.
So tell me how to do that again.
So it's called a Valsalva technique. And so you pinch your nose and you blow like you're going to blow your nose. You take a deep breath and you blow and you can make your ears pop. You can blow air
and that's
up
forcing
the
that
tube.
Okay, and that's forcing it open essentially.
Correct.
Okay.
Now, if it's really swollen and you try and do that, and especially if you're in the airplane, it can hurt. So it's one of those things that you can do. You just got to be cognizant of your overall health. If you're really sick and you're trying to do that, not such a good idea.
Okay.
If you're perfectly healthy and you're doing that, you just can't get your ear to pop. That sometimes can be the thing that helps. The most important thing is when you do it is to make sure your nose is not congested.
Okay. Are there any other tips you have for popping your ears?
We talked beforehand a little bit about things you can do not to get sick or not to have a problem on an airplane. And one of the things I'll tell patients is use some Afrin nasal spray in your nose. Really? It's one of the few times I'll tell people to use Afrin. So, Afrin is one of those, they talk about medicine that you can, or I say Afrin, that's the trade name, oxymetazoline or neosynephrine. That's the generic names of those drugs. And so those drugs serve to decongest the nose. It makes the little blood vessels in there shrink up, and so the nose gets really open, and you can breathe better. And so if your nose is nice and open, you have a better chance of being able to equilibrate when you go up in an airplane and you come down on an airplane. And so that's something that's certainly very helpful to try, especially if you have problems with your ears kind of chronically. Obviously in terms of being healthy on an airplane, you're in a closed metal tube with a lot of people with recirculated air. And so it's the perfect opportunity, if you're not sick, to get sick. One of my professors used to tell me that flying a lot was a potential risk factor for getting sinus infections because you're allowing that recirculated air so much. People got to travel. You can't not live your life and go where you need to go because you're worried about getting sick. That's what your immune system's for, to help fight stuff off. But making sure that your nose is not congested, obviously washing your hands as much as you can, are common sense things that you can do. So
there are some products on the market that encourage you to take before you fly that'll keep you from getting sick. Is that worth it?
I get that asked a lot. And I would say it depends. Some people have the idea that those medicines are the things that keep them better. If it's not hurting them, I would hesitate to take that away from them because even if it's a placebo effect, they believe in it.
Right.
It's not something that the American Academy of Otolaryngology recommends. And I suspect that if it was something that really worked universally, they'd be passing it out to everybody, or,
Right.
and so I think there's a subset of people that believe in that, and I think that's fine. From a medical standpoint, do the things that make sense. If you're sick and you can avoid getting on an airplane, because I sometimes see people that are really sick, that have really bad ear infections, and they really don't want me to put a tube in their ear, but they really don't want to get on an airplane and have the potential sinus squeeze or ear squeeze.
Right. It's very uncomfortable.
It's really uncomfortable. And so if they can reschedule the trip, great. If they can't, we try to give them a bunch of antibiotics and some steroids. It's one of the few times I'll actually give people steroid shots to try to help people get better as fast as they possibly can, and tell them if you got to go, use some of those nasal decongestants. Pseudoephedrine or phenylephrine, those are both oral decongestants. They can work well. I just don't think they work as well as some of the topical stuff. And I tell people, don't use the topical stuff all the time, but before you get on the airplane, can be really helpful.
So lots of good tips for traveling and keeping your head from getting clogged, I guess.
Yeah.
As I like to say it.
We all don't want the head to be clogged, but if it does happen, there is help available, and most of the time you can get through those kinds of events without having to have an operation.
So, Dr. Swain, since we're talking about flying, I'd like to know, are you a good flyer? Or are you like my husband, Johnny, who's a terrible flyer?
I think I've changed over the years. I think, when I was younger, I wasn't on an airplane that much. I thought I was a great flyer. I'd get in and it would be so much fun. Even in college, the few trips I took, it was always, this is what an adventure. Now that I'm older, going up and down on the airplane, I can understand why people get motion sick. And so that kind of weighs on me a little bit. In terms of having a sinus infection on a flight, I was sick and I've been on an airplane before. And so I have a lot of empathy.
Well, that's helpful. I like to know my doctor has empathy.
I have a lot of empathy for people who get off the airplane going, I'm sick and my face hurts. I mean, there was one of those times I never will forget it. I was on the airplane and we were descending and I'd been taking exams. I was really sick and my face hurt for 3 days afterwards.
Oh.
It was terrible. So, I think I like the idea of flying more than I actually like getting on the airplane to go, but you do what you got to do.
Right.
I think that flying has gotten a lot better in terms of, trying to keep people safe and trying to keep people healthy on an airplane. But the things that you can do to protect yourself, obviously, is make sure your nose is open on the airplane. And when you are descending, make sure you have some water or something like that to swallow to help make sure your station tube stays open. So
you mentioned having some water on the way down to help equalize my pressure.
Yeah.
What about alcohol? What if I'm drinking a beer or a glass of wine?
The alcohol itself is not going to make a difference. It doesn't matter what you're swallowing. It's the mechanical action of swallowing to help your palate move so your eustachian tube will open. And certainly sometimes they don't serve alcohol in flights as well. So that's the alcohol part of it is not the answer. It's going to be more along the lines of trying to get your eustachian tube open by swallowing.
Those are great pieces of advice for your next trip.
Hopefully I can take my own advice. That's the hard part. Sometimes it's easy to talk and harder to actually follow the advice that
That's right.
You should do. But it's always a pleasure to be able to talk. And these are some of the questions I get all the time.
Really?
All the time.
So listeners, if you want consultation with an empathetic doctor and traveler out there, how do they get in touch with you?
So the easiest way is obviously picking up the phone and calling. The numbers are 251-473-1900 and 251-633-2667. We're experimenting with website appointments. Usually if you make contact through the web, one of the appointment schedulers will call and get you scheduled as well. We're trying to go to a fully automated system at some point, but right now it's hard sometimes to work around people's schedules, and usually you need somebody to talk to. But those web addresses are the links in the Swain Sinus Show. That's an easy way. And then our group site, Premier Medical, that's premiermedicalgrp.com, and then Mobile ENT Doctor, dr.com. And the last one is Dr. Ron Swain Jr.com. That's DRRONSWAIN.com.
Great. Thank you so much.
Thank you.
Thanks for listening to the Swain Sinus Show. Please subscribe to our show on iTunes, Overcast, and anywhere you download your favorite podcasts. Want to know more about Dr. Swain or to schedule a consultation or appointment? Visit SwainSinusShow.com or call his amazing nursing staff at 251-470-8823. We would love to hear what you think about the show. Email us at drswain@drronswain.com. Again, thanks for listening. Breathe easy and have a great day. This show is brought to you in part by the fine physicians and friendly staff at Premier Medical Group in Mobile, Alabama.